So this trial builds on work done by our group looking at the potential of a peptide vaccine to prevent disease recurrence. So going way back, there is a HER2-derived peptide E75, which is Nelipepimut-S, that has been shown to be immunogenic, meaning that it can be recognized by T cells. So what our group did was to combine that with GM-CSF as a very simple strategy whereby we inoculate patients after they've been rendered disease-free with their standard of care therapy, so surgery, chemotherapy, or radiation, with the goal being to stimulate an immune response that will help prevent recurrence. And those early phase trials suggested that the vaccine could potentially decrease the risk of recurrence by about 50%. Now, when an oncology type talks to you those kind of numbers, you have to be a little careful because going from 2% to 1% is one thing. But this vaccine enrolled, the early trials enrolled patients who had about a 20% risk of recurrence that was dropped down to about 10%. So the ongoing phase 3 trial is what we call a registration trial. It's what we hope will be the definitive study. It's a large study, well-powered, in order to determine if that vaccine indeed does decrease the risk of recurrence, which could potentially lead to approval for use as part of standard treatment.